It is a known medical fact that surgery comes with pain. Any surgical procedure involves a surgical incision or cuts into body tissue or an organ. The pain and a person's reaction to it is highly individualized. The amount and severity of surgical pain depend on your general physical condition and health, your pain tolerance, and the operation you are having. Some major operations can cause more surgical pain than some minor operations. These are the 7 most painful surgeries and medical procedures, according to the patients who have had them. Number 1. Bone marrow aspiration and trephine/biopsy. The reason for this procedure is to investigate any disorder of the bone marrow, from leukemias and lymphomas to bone marrow diseases such as myelofibrosis, bone marrow fibrosis. Although this is not a common test, it is arguably the most painful test. In general, solid organ biopsies are not very comfortable, but bone marrow aspiration is in a league of its own. This is where a direct bone marrow tissue sample is taken from the conscious patient. Although this procedure involves local anesthesia, it is only injected into the superficial skin, and since bone is rich in nerves, it is very sensitive to the large needles that are pushed in and out of part of the marrow. For some patients, it is too difficult to handle and must be performed under general anesthesia, although this is not common. Number 2. Gallbladder removal, cholecystectomy. There are 2 types of cholecystectomy, laparoscopic cholecystectomy and open cholecystectomy. Recovery from laparoscopic cholecystectomy is usually very quick and does not cause much pain or discomfort. On the other hand, many people who have an open cholecystectomy say that it's painful both immediately following surgery and throughout the recovery period. The pain may last 4 to 6 weeks but should leave you in less pain than before surgery. One reason for the pain is that your body has not adjusted to its new inability to digest fat as much or as often as it did before surgery. Some patients have had success reducing their intake of fatty foods or breaking up a fat-containing meal into several smaller meals. Number 3. Dental implants. The recovery period for dental implants can be long and painful. The actual procedure usually involves minimal pain from an anesthetic injection, but the months of recovery that follow can be very painful. You may experience swelling, bruising, and bleeding in your mouth. The most difficult part of this surgery is that every time you eat food that requires the use of your teeth, you will feel pain. Dental implant treatments can be very painful. The extent of pain and discomfort varies in each case. However, dental implants are among the most painful and lengthy cosmetic treatments available today. Number 4. Liposuction. Liposuction is an elective procedure. It has to do with the removal of subcutaneous fat and body sculpting. You may choose to have liposuction if you discover your body fat is unevenly distributed and accumulates in certain areas, like under your arms or in your thighs. The immediate result is severe bruising and discomfort, and it surprises people if it's their first time undergoing the procedure. Recovery time is determined by the amount of fat removed and the location of the procedure. You may feel pain for a few days or several weeks. It is important to note that whatever type of liposuction you choose, whether it is VasorLipo, Smart Lipo, or traditional liposuction, your surgeon's aim is to make your experience as painless as possible during the procedure. Number 5. Total hip replacement. The surgery varies for people in terms of the extent of pain. Most people would agree that the recovery and rehabilitation process involves a high degree of pain. Hip pain can spread to other parts of the body, including the legs and groin. However, most people experience surgical pain for approximately 2 to 4 weeks after hip replacement surgery. Your activity level, medical history, and any pain you had before surgery affect how long it will take for you to make a full recovery. You should be able to resume most of your normal activities 6 to 12 weeks after the procedure. Number 6. Open, abdominal hysterectomy. Unlike laparoscopic hysterectomy and vaginal hysterectomy, which generally have lower levels of pain. The discomfort and pain of an abdominal hysterectomy can persist for several weeks after surgery. Your abdominal muscles are used for many of the movements you perform throughout the day. Even things like standing up or rolling over in bed can be painful after surgery. You may feel discomfort at the incision site for approximately 4 weeks, and any redness, bruising, or swelling should subside within 4 to 6 weeks. Burning or itching around the wound is normal. You may also feel a tingling sensation around the incision and down your leg. Number 7, colonoscopy. The purpose of this procedure is to detect intestinal problems ranging from bowel cancer, inflammatory bowel disease, polyps, diverticulosis, and many more. A small bore camera is inserted through the back passage and allows for direct visualization, biopsy specimens, and even treatment of diseases affecting the large intestine. However, it requires a lot of preparation. The intestines must be cleared to allow good vision, usually 2 days before taking strong laxatives and a clear diet, and it can be very noisy as air needs to be blown into the intestines. Some patients find the procedure unbearable after some distance in the intestine, so the procedure should be abandoned. To make matters worse, the scope can get looped during this process, which is as painful as it sounds.